Why have we got a healthcare delivery crisis all over the world? And you thought it was just where you live? Ha! Stay tuned.
You wanted real talk, and this is where you'll hear it. Uninhibited by the toxic influences of cancel culture, unvarnished and unfettered, unencumbered by the censorship of traditional radio, uncontaminated by big media interests.
And now, Sherman Unlimited.
Where I live in Ontario, Canada, we are seeing some periods where hospital emergency rooms are temporarily shutting down for lack of critical nursing staff. The growth in the BA.5 Omicron variant of COVID hasn't helped either, and it is now forecast to swell through fall and winter. If I read Twitter comments, there are several prominent whiners, socialists to be sure, who think this was caused and left to fester by the provincial government of Ontario, where I live. To be sure, it is the responsibility of the Ontario and every other government to address deficiencies in our healthcare delivery system. But to suggest this is only happening where I live is just a fool's errand. I did some research, and I'll just put it out there, complete with quotes, and then I'll give you a perspective that you may not have considered. There's an organization called the European Public Service Union, and it speaks for healthcare workers, among others. The EPSU headline reads, "Staff shortages in health increase across Europe." Here's a quote from a January publication by that group. "Many European countries are facing severe staff shortages in health and care due to the recent Omicron wave. These have been exacerbated by the COVID crisis. Almost all EU countries report a shortage of healthcare staff. EPSU has been pointing out the severity of the staff shortage, around 2 million workers. Europe's governments should substantially increase funding for health and care and respond to demands of workers to invest. The Omicron wave is demonstrating how urgent this investment is, and the WHO stresses that once again the greatest burden of responding to this pandemic is being carried by our health and care staff." Let's jump across the ocean back closer to us into the United States. The SMA, or Southern Medical Association, said this: "The demand for nurses in the healthcare industry today is staggering, an issue that reached a critical point last year. As early as 2009, studies had estimated a shortage of 1 million nurses for the year 2020, and the pandemic only exacerbated the issue. With the entire healthcare system more compromised than ever, the shortage of nurses who serve as patient advocates, essential members of the medical team, and support systems for families is even more prominent. Understanding what led to the shortage and how it can be overcome is paramount to public health and recovery. The SMA attributes much of this to an aging population. Older means more patients, and older also means fewer nurses. Simple. Not to fix, but to understand. And I recall the same bells going off where I live 10 years ago. But did anyone do anything about it? Not bloody much. Again, in the USA, here's a main reason for the problem: education. Quoting from the SMA, "Despite a promising career with job security, good compensation, and fulfilling work, there just aren't enough nurses in the field today. The main bottlenecks in nursing schools are limitations on budget, faculty, staff, and other resources. The already limited number of teachers are looking to retire in the next decade, too, and filling these positions is challenging as teachers are required to have higher educational attainment and more experience, but earn less than their counterparts in the field." Now, in Canada as a whole, yes, Ontario has a nursing shortage, has problems in that area leading to ER closures and patient reassignments. British Columbia has the same problem in the west. New Brunswick has it in the east. In June, so basically 6 weeks ago, Statistics Canada reported an all-time high of 136,800 job vacancies within the health sector throughout the first quarter of 2022. Nearly double the amount reported in the first quarter of 2020. And additionally, 1 in 4 nurses said they plan on quitting their job in the next 3 years. So here's the perspective I referred to earlier. There is no more of an Ontario-Canadian issue than there is a German one or an American one. We were all of us told to expect to have a huge demand for replacement workers as time wore on. I read a document from a substantial college over a dozen years ago called People Without Jobs, Jobs Without People. In other words, they're referring to a mismatch. We have all these folks who want to work. Maybe everyone wants to be a vice president. And then we have all these jobs that are going wanting. I was part of a study group looking into this at the time, and our conclusion way back then was to promote education as young people approached the period where career choice was becoming mandatory. Education as in qualitative, attractive, interesting, and promising reasonable compensation. We did not do enough of that. Seems no one anywhere did. We are in a time where first world countries have shrinking youth populations. Average age of the population is growing, and that includes the age of the nurses. We have no choice if we intend to provide high quality and timely treatment. One, we have to find the money to pay healthcare workers more. It is a necessity. Number two, we have to rush on credentialing foreign-trained nurses awaiting acceptance. Number three, we have to recognize the longer lifespans of today and incentivize all nurses who can effectively function to keep working instead of retiring. Number four, we have to offer as yet uncreated courses in nursing assistant in our colleges. Maximum, say, 2 years, 1 in school, year 2 in hospitals. And five, we have to broaden the duties and abilities of nurse practitioners to relieve tension on both the doctors and the existing nurses who have done yeoman service during COVID and will likely be called upon to do it again. Getting onto a scrolling bulletin board called Twitter, where people toss their unconsidered thoughts or garbage into the public realm, is not going to solve anything, and isolating blame within individual jurisdictions around the world to politicians is pointless. Let's take decisive action, and where Canada is concerned, let the federal government get off its collective ass and rewrite the Canada Health Act while doing its part to enhance the dollar transfers already mandated to help in these efforts. I'm Peter Sherman.
Sherman Unlimited.
What do you know about Florida Governor Ron DeSantis? Well, if you spend any time down there at all like me, you know a lot. Why? Because DeSantis is an in-your-face governor with his own ideology that's pretty clearly hard Republican. I meet Floridians who think he walks on water. I meet others who wouldn't take their foot off his head to keep him from drowning. I like him. I like him not for all of his policies, because I'm not the kind of guy who, by liking someone, automatically follows suit and commits to any and all policies or statements or whatever, much less anything the guy says. DeSantis was in the national spotlight, you'll remember this, during the heaviest COVID period because the numbers suggested COVID was overrunning Florida, while the governor's general policy was, take care of yourself and don't go looking for it. But he didn't do a lot about it, closed very little, and only for a very short time at the outset. In fact, for snowbirds like me, traveling to Florida at the end of 2020 was out of the question. Canada's Prime Minister, God help us, was railing against any travel at all, and we mere mortals were reading numbers from Ontario and comparing them with numbers from Florida, and we were concluding that we got COVID right and they got it wrong. I stopped believing that, though, somewhere along the way, and in February of 2021, as my wife and I watched the evening news and saw Trudeau saying, do not travel, we made an instant decision to follow those big signs on the trucks that you saw riding around Ottawa last winter, and we booked tickets. And we went down to Florida the following week. We stayed February to June, had a ball, had no Canadian friends down there at all. We were it. But we have many American friends and many relatives, and there was no problem shopping, no problem dining out. And we had a lot of DeSantis to listen to while we were there. Even if you don't care for him, you have to admit you know where he stands. Here's what you may not know about Governor Ron DeSantis, who will, I suspect, one day be President Ron DeSantis. He is 44 years old. He's an attorney. He was a congressman prior to successfully setting his sights on and running for the governorship in 2019, which of course he won. To any of you who believe this guy is some dummy, he graduated from both Yale and Harvard universities, and he served in the United States Navy. He is a born Floridian. During the COVID-19 pandemic in Florida, DeSantis resisted imposing restrictions such as face mask mandates, stay-at-home orders, and vaccination requirements. In May 2021, he signed into law a bill that prohibited businesses, schools, cruise ships, government entities, all from requiring any proof of vaccination. In March 2022, DeSantis signed into law the Parental Rights in Education Act. Some people call it the Don't Say Gay law. It prohibits instruction on sexual orientation or gender identity in public school classrooms from kindergarten to grade 3. There are a lot of people in Ontario who might agree with that. In fact, in a lot of places. And there are others who don't. So that's Ron DeSantis, governor of Florida, and why you may or may not like him. Usually it's one or the other, very few in the middle. I'm talking about the governor today because he's in the news today. He suspended his attorney general because that attorney general refused to prosecute on laws he didn't like. The focus here was the overturning of Roe v. Wade. DeSantis says that no abortion is the law of the land and no attorney general of his will try to thwart it. Here's Governor DeSantis.
You don't elect people in one part of the state to have veto power over what the entire state decides on these important issues. The Constitution of Florida has vested the veto power in the governor, not in individual state attorneys. And so when you flagrantly violate your oath of office, when you make yourself above the law, you have violated your duty, you have neglected your duty, and you are displaying a lack of competence to be able to perform those duties. And so today we are suspending State Attorney Andrew Warren effective immediately. We are not going to allow this pathogen that's been around the country of ignoring the law. We are not going to let that get a foothold here in the state of Florida. We are going to make sure that our laws are enforced and that no individual prosecutor puts himself above the law.
Now, I have a position on this, and it's counterintuitive. So be it. I happen to be conservative. I happen to like Governor Ron DeSantis. I believe that Roe v. Wade served a useful purpose, and frankly, the libertarian side of me does believe that women have rights, which include control over their own bodies. So while I happen to personally believe that life begins at conception, I also believe that freedom of choice is a legitimate concept because I cannot put myself in the position of deciding for that would-be mom, nor would I if I could, and nor should anyone else have that right. That said, I'd have tossed Attorney General Warren out too. It's related directly to my admiration of Governor DeSantis. No individual public official anywhere gets to decide which laws are good and which ones are bad. Legislators collectively create and pass laws for all of us. That's why they're called our representatives. Some of those laws we don't believe in or go along with. Doesn't mean we get to opt out. We can fight them in the courts, we can demonstrate on the streets, but those laws must be enforced for however long they endure as laws. The Attorney General said no. Governor Ron DeSantis said goodbye. Governor DeSantis made the right choice. I'm Peter Sherman.
Sherman Unlimited.
Let Peter know what's on your mind. Drop him an email. info@petersherman.com.
Find future episodes wherever you find your favorite podcasts. So if you like what you've heard, tell a friend. If you really liked it, tell 3 friends. If you really hated it, tell 3 enemies. We'll talk again soon.